Hello everyone, this is Team CHM. We would like to thank SAEM for this opportunity. The title of our project is Pediatric Minor Head Injury Related Return Visits to the Emergency Department and Their Outcome. We do not have any disclosure. Head injury in children is a common emergency department presentation. It is well established that majority of these are minor head injuries. Most of these children do not require any imaging or any intervention, and they can be safely discharged home. However, there is a lack of information on ED return visits in children with minor head injury and their outcomes. We believe that this is vital information as it may help reassure the providers and may likely influence their CD utilization rates. The objective of this study was to describe the frequency and outcome of minor head injury related return visits to the pediatric emergency department. Our hypothesis was that only a small proportion of these patients come back to the ED and that missed intracranial injuries are rare. This retrospective study was conducted in an inner city level 1 trauma center. At our institution, we use Pecan head injury prediction rules to guide CT decision making. Our institution's 72-hour return visit database was used to identify the study population. Children less than 18 years of age who had a return visit within 72 hours for head injury related complaint were eligible for inclusion. They were excluded if the revisit was for any unrelated complaint or if it was for a new episode of trauma or if the patient had comorbidities like intracranial shunt or bleeding disorders. During the study period, more than 6,000 children were seen for minor head injury at our center. Of them, 82 had a return visit within 72 hours. Only 61 met the inclusion criteria and included in the final analysis. As you can see, the return visit rate for minor head injury patients was around 1%. This is very reassuring as this rate is actually much lower than the average return visit rate to our institution. This slide gives you the demographic and the clinical characteristics of the study population. The majority of patients were old and were in the 2 to 17 years age group. Mechanism of injury was mostly non-severe, with accidental fall being the most common reported mechanism in nearly 2/3 of the patients. Most of the return visits had concussion-related symptoms, with headache and or vomiting accounting for 2/3 of the presenting complaints. Of all the revisits, 3 of them were likely preventable, as these patients were called back to the ED for further evaluation because radiological findings were missed on the index visit. Though the overall number of return visits remained low, nearly 2/3 of them required some form of intervention. That included a combination of IV hydration, pain management, neuroimaging, and or subspecialty consultation. The revisits on the whole were associated with a good outcome. Majority of patients were discharged from the ED. There was no mortality reported in our study population. Missed intracranial injuries were rare, as only one patient on revisit was found to have a clinically important traumatic brain injury. This was a 4-year-old boy who initially presented following a fall from his father's shoulder. Besides one episode of vomiting, there were no other presenting complaints. His GCS and neurological exam were normal. He was observed in the ED for around 3 hours and was then discharged home. He presented again with persistent headache and vomiting. His GCS and neurological exam were still normal. Because of the persistence of symptoms, CT scan was done, which showed a posterior fossa epidural hematoma. He underwent surgery and was discharged home with no deficits 4 days later. There were limitations to our study that included retrospective design and the small sample size. It is possible that some of our patients may have represented to other local EDs for worsening or persistent symptoms. However, since we are the largest trauma center in the region, we feel that this is less likely to have occurred, especially with respect to the traumatic brain injury on the revisit. In conclusion, minor head injury related return visits remain low and constitute a small proportion of all the return visits to the pediatric emergency department. Although 2/3 of them require some intervention, they are likely and largely associated with good outcome. Missed intracranial injury is rare. Focused interventions targeting preventable causes like radiological misses can further help decrease the number of these revisits. Thank you.